To test thumb MCP flexion, specifically the flexor pollicis brevis, the patient is seated in forearm supination and supported on a flat surface with the wrist in neutral, and MCP and IP joints of the thumb are extended. Stabilize over the sides of the first metacarpal and palpate the flexor pollicis brevis over the volar aspect of the first metacarpal bone. Then passively flex the MCP joint while keeping the IP joint extended to end range, and then have the patient actively do so. Then apply resistance on the volar surface of the proximal phalanx of the first metacarpal, or the first digit. To test thumb IP flexion for flexor pollicis longus, the patient is seated with their forearm supinated and supported on a flat surface with their wrist in neutral, and their MCP and IP joints of the thumb are extended. Stabilize at the proximal phalanx of the thumb and palpate the tendon of the flexor pollicis longus on the volar aspect of the proximal phalanx. Then passively flex the IP joint to end range and ask the patient to do so while palpating. And then apply resistance to the volar aspect of the distal phalanx in the direction of IP extension. To test thumb MCP extension, specifically the extensor pollicis brevis, the patient is seated with their forearm in neutral position with their wrist in neutral and MCP and IP joints of the thumb in slight flexion. Stabilize the first metacarpal bone and then palpate the tendon of the flexor pollicis brevis just radial to the extensor pollicis longus. Then passively extend the MCP joint while allowing the IP joint to stay flexed, and ask the patient to do so actively. And then apply resistance to the proximal phalanx towards the direction of MCP flexion. To test thumb IP extension, specifically the extensor pollicis longus, have the patient seated with their forearm in neutral rotation and supported on a flat surface with their wrist in neutral position and MCP and IP joints slightly flexed. Stabilize the side of the proximal phalanx of the thumb and palpate the tendon of the extensor pollicis longus on the dorsal side of the first metacarpal and proximal phalanx of the thumb. Then passively extend the IP joint into end range, and then ask the patient to do so while palpating. Okay, and then apply resistance to the dorsal aspect of the distal phalanx with one finger. For thumb abduction, the abductor pollicis longus and brevis, the patient is seated with their forearm supinated and supported on a flat surface with their wrist in neutral and their thumb adducted. Stabilize at the volar surface of the wrist in 2nd through 5th metacarpals and palpate the abductor pollicis longus and brevis. Passively move the thumb into abduction and have the patient do so while palpating. And then apply resistance to the first metacarpal bone in the direction of CMC Adduction for abductor pollicis longus, and then on the proximal phalanx of the first digit for abductor pollicis brevis. To test thumb adduction, so the adductor pollicis, the patient is seated with their forearms pronated and supported on a flat surface with their wrist in neutral, and hand and thumb can be extending past the surface. You're stabilizing at the dorsal aspect of the wrist and the 2nd through 5th metacarpals, and then palpate at the adductor pollicis between the 1st and 2nd digits. Then you will move the thumb into adduction passively, and then ask the patient to do so while palpating. Okay, and then apply resistance at the proximal phalanx towards the direction of CMC Abduction. To test thumb opposition with the 5th digit, testing the opponent's pollicis and opponent's digiti minimi, the patient is seated with their forearms supinated and supported on a flat surface with their wrist in neutral position and fingers extended. There is no stabilization needed, and to palpate the opponent's pollicis, go along the radial border of the 1st metacarpal, and then the opponent's digiti minimi on the ulnar border of the 5th metacarpal. Then passively oppose the thumb and pinky to show the patient the desired movement, and have the patient do so while palpating. And then apply resistance on both sides simultaneously by attempting to separate the 1st and 5th digits.